Hey everybody, and welcome into this very special episode of Ask the Doctor. Behind all of this, I am Will Cooper, and we're bringing you this next episode from right here in the operating room. So as you can see, we're all decked out, and we're going to go over what's so special about this new operating room on this episode. So you're not going to want to miss this one. This one's going to be very different than what we normally do. So stay tuned, and let's meet our doctors.
Dr. Wilson and Dr. Kang, thank you for being with us.
Yeah, thanks for having us.
Hi, thanks for having us.
We're happy to show you our new room here.
Let's get started here. What does endovascular mean?
So endovascular surgery is a type of vascular surgery where we use minimally invasive techniques, which oftentimes means using stents or balloons to help open up arteries or perform venous procedures or other state-of-the-art procedures as well.
We're in a hybrid operating room. What does that mean exactly?
Well, traditionally, procedures were performed either in a minimally invasive room or in a normal operating room suite, and we could only do one type of procedure in each of those rooms. A hybrid room incorporates both elements where we could do minimally invasive procedures with high-tech equipment, limiting the amount of radiation and dye and limiting the number of procedures that we have to do for a patient. But we can also do big open procedures that normally would have to be done at a separate time.
What are some of the benefits for a surgery if a patient has one in a hybrid operating room?
Because this is a one-stop shop, it means the patient's able to come in with only one dose of anesthesia, have one procedure done where we're able to perform both minimally invasive and open procedures. Oftentimes this means less operative time, less contrast, which is important for the kidneys. Also less radiation, and overall has been proven to decrease patient admission stays and improve their recovery as well.
What type of procedures can be done in a hybrid operating room?
The vascular surgery field is constantly evolving, and we are able to treat a number of vascular beds, including carotid surgeries in the neck and also procedures that involve the chest or the belly, or more traditionally in the legs. And we can do a combination of open and minimally invasive procedures in these hybrid rooms, utilizing the newest technology, which again makes the procedure safer, faster, more efficient, and better for the patient.
That's all the questions I have for you, but can you take some time and show us around the hybrid operating room?
So when we were talking about our minimally invasive procedures, in order to do these procedures, we need to use X-ray. This is our X-ray unit. This is what actually produces the X-rays so we can see what we're doing. When we're doing a procedure, we have to insert wires and we have to insert devices such as stents. In order to make sure they're positioned appropriately when we're in the right location, we have to use X-ray in order to see what we're doing. But this is how we keep it minimally invasive so that we don't actually have to open any area of the body to see what's going on.
Yeah, so as we're advancing wires, catheters, or deploying stents, we're actually using X-ray. This will actually hover over the patient's body, and then we can watch the stent get deployed to ensure it's being deployed in the correct position.
And the neat thing about this unit is that because it's on a robotic arm, the arm itself can actually move over the patient. It can rotate 360 degrees around the patient, and it also allows us to integrate CAT scans or other X-rays that we had out before the patient got to the operating room and help us perform the procedure much more efficiently. So this is the control panel where we can control the robotic arm. We can control the bed and move the patient up or down. This also allows us to control the radiation that's exposed to the patient as well as ourselves. The software allows us to perform procedures with laser guidance and imaging. So this also allows us to control what we see on these screens. We have a number of different technologies, including intravascular ultrasounds that let us see the vessels in higher detail. And we can also keep a close eye on the patient's vital signs and make sure that while we're operating, that the patient remains safe.
So something that doesn't seem like a big deal is all of the storage, but really Dr. Kang and I are very excited about it because it means we'll have all of the wires, catheters, and stents that we need directly available. So no longer does anyone have to leave the room to find the necessary equipment. It's all right here, which speeds up the operative time and makes it safer overall.
This has been Ask the Doctor, presented by our friends at Northside Hospital, Cherokee.